Hello and welcome. Today we're diving into a less commonly discussed but important condition called urethral prolapse. We'll explore what it is, what causes it, how it's diagnosed, and the available treatment options. This information is for educational purposes only and does not substitute professional medical advice. Let's begin by understanding the potential causes, or etiology, of urethral prolapse. While the exact cause isn't always known, several factors can contribute. These include increased abdominal pressure due to chronic coughing, constipation, or straining during bowel movements. Pregnancy and childbirth, especially difficult or multiple vaginal deliveries, can weaken the pelvic floor muscles that support the urethra. Estrogen deficiency, often seen after menopause, can also lead to tissue weakening in the urethral area. Additionally, a history of pelvic surgery or radiation therapy may increase the risk. Now, let's discuss the pathophysiology, or how the condition develops. Urethral prolapse occurs when the inner lining of the urethra, called the mucosa, protrudes through the external opening, the urethral meatus. This happens because the supportive tissues and muscles surrounding the urethra weaken, failing to maintain its normal position. The weakened tissues allow the urethral lining to essentially turn inside out and bulge outwards. This exposed tissue is vulnerable to irritation, inflammation, and bleeding. Regarding epidemiology, urethral prolapse is seen most frequently in young girls before puberty and in postmenopausal women. It's relatively rare in women during their reproductive years. The reasons for this age distribution are linked to estrogen levels and the strength of the pelvic floor. While precise statistics are limited, it's considered a relatively uncommon condition overall. Let's turn our attention to the signs and symptoms. Many individuals with urethral prolapse experience bleeding from the vaginal area or blood in the urine. A visible reddish, donut-shaped mass protruding from the urethral opening is a hallmark sign. This mass may be tender or painful to the touch. Other symptoms may include difficulty urinating, painful urination, urinary frequency or urgency, and pain during intercourse. Diagnosis typically involves a thorough physical examination by a healthcare professional. The characteristic appearance of the prolapsed urethra is usually sufficient for diagnosis. However, further investigations may be necessary to rule out other conditions. A pelvic exam can help assess the extent of the prolapse. A cystoscopy, which involves inserting a small camera into the urethra, may be performed to visualize the urethra and bladder. Urine tests, such as a urinalysis, can help detect infection or other abnormalities. While urethral prolapse isn't formally classified into distinct types, it can be described based on the extent of the prolapse and the presence of any associated complications. For instance, it can be mild, moderate, or severe depending on how much of the urethra protrudes. Additionally, it might be complicated by inflammation, ulceration, or infection. Treatment and management options depend on the severity of the prolapse and the patient's symptoms. In mild cases, especially in young girls, conservative management may be sufficient. This includes sitz baths, topical estrogen cream to strengthen the tissues, and good hygiene practices to prevent infection. For more severe or symptomatic cases, surgical intervention may be necessary. Surgical options include excision of the prolapsed tissue and reattachment of the urethral mucosa to the surrounding tissues. Another surgical approach involves tightening the supportive tissues around the urethra to prevent future prolapse. While it's not always possible to completely prevent urethral prolapse, there are steps that can be taken to reduce the risk. Maintaining a healthy weight, avoiding chronic constipation and straining, and performing regular pelvic floor exercises, such as Kegels, can help strengthen the pelvic floor muscles. In postmenopausal women, estrogen replacement therapy may be considered, but this decision should be made in consultation with a healthcare provider. The prognosis for urethral prolapse is generally good, especially with appropriate treatment. Most patients experience significant symptom relief after surgical correction. Recurrence is possible, but relatively uncommon. Recent research focuses on improving surgical techniques and exploring less invasive treatment options. Scientists are also investigating the role of collagen and other connective tissue components in the development of urethral prolapse to potentially identify new targets for prevention and treatment. Thank you for joining us on this informative journey. Remember to consult with your doctor for any health concerns.